Have you ever been attempting to walk or exercise but have difficulty doing so as a result of leg pain? Do you find yourself weak and fatigued from your legs when you go shopping? Does the pain or weakness from your legs disappear with rest? Could these symptoms indicate that you have simple arthritis, or could there be something more serious? Stand by for the answers as Get Healthy with Dr. Cooper starts now.
Welcome to Get Healthy with Dr. Cooper. Discover the secrets to amazing health and longevity. Learn how lifestyle medicine, the vaccine for chronic diseases, can profoundly influence mind and body. Learn simple solutions such as healthy nutrition, exercise, strong family bonding, stress management, and spiritual renewal will empower you to live a longer, healthier, and more abundant life. And now, here's Dr. Donna Cooper.
Our topic today is peripheral vascular disease. Peripheral arterial disease is a chronic arterial occlusive disease of the lower extremities caused by atherosclerosis. The peripheral artery disease may cause intermittent claudication, which is pain or weakness on walking that is relieved with rest. The muscle pain or weakness after exercise occurs distally to the occlusion of the artery. Since the obstruction is usually seen in the vessel in your thigh, which is called femoral artery, or the one in your leg, popliteal artery, most of the pain is usually seen in the lower leg, in the calf. However, if the occlusion is higher, such as in the abdomen, in the aorta, which is a large vessel coming from the heart, then the pain could be in the lower back, in the buttocks, in the hips, or in the thigh. Now, there are some patients who do have poor circulation. However, they might not have leg pain. It is believed that 50% of patients with documented peripheral vascular disease are asymptomatic. They have no pain at all. These patients who do not walk far enough or fast enough will not induce leg pain. Patients with lung disease or heart disease or arthritis usually do not have pain. When the peripheral vascular disease is very severe, which means that there's little blood flow or no blood flow that gets to the toes and the feet, this could produce what we call critical ischemia, in which the patient will have pain at rest. Chronic arterial insufficiency will progress to ulceration seen in the ankles, the heel, and in the leg. In these cases, patients will develop gangrene. Gangrene now is a destruction or death of the tissue as a result of lack of circulation and lack of oxygen. Patients with severe peripheral vascular disease usually have decreased or absent pulses in their lower extremities. When the doctor performs tests like ankle brachial index, a test in which the systolic blood pressure of the upper extremity is compared to that of the legs to determine the flow of blood to the legs. There is also a second test that detects poor circulation to the lower extremity. This is the arterial duplex study, which is a sonogram of the lower extremity. The Doppler sonogram method allows characterization of the flow versus time velocity wave. Finding a biphasic flow at the groin or a monophasic flow more distally is evident that there is an obstruction. These are just a few tests that are used to confirm peripheral vascular disease. Now, what are the modifiable risk factors that could predispose someone to peripheral vascular disease? The goal of today's program is to educate you on ways in which you can prevent chronic diseases by modifying risk factors. Here are some risk factors to be addressed. Number one, smoking. Smoking increases the risk for amputation in patients with poor circulation to the legs. Smoking cessation therefore decreases the progression of peripheral vascular disease. It also decreases the risk of a myocardial heart attack or death from any vascular causes. So if you are a smoker, speak with your doctor about various methods that may assist you in decreasing the craving for nicotine. Number 2, hypertension. The blood pressure should be adequately controlled to reduce the risk of vascular death and morbidity in patients with peripheral vascular disease. The aim is to decrease the blood pressure to less than 140/90. And number 3 is diabetes. Elderly patients with diabetes and peripheral vascular disease and no coronary artery disease have 1.5 times higher incidence of having a heart attack than patients who are diabetic with PAD, peripheral vascular disease. The higher the hemoglobin A1C level in patients with diabetes and peripheral vascular disease, the higher the prevalence of severe peripheral vascular disease. So the aim is to keep the blood sugar control and to reduce the A1C to less than 7%. Number 4, high cholesterol, hyperlipidemia. Studies have shown that patients with peripheral vascular disease who get treated with cholesterol-lowering agent or lifestyle modification will significantly lower the risk for amputation or other complications such as coronary artery disease. A diabetic patient should have their LDL or their bad cholesterol below 70. For non-diabetic patients, the LDL should be less than 130. And number 5, hypothyroidism. Hypothyroidism is known to be a risk factor for peripheral artery disease. Patients with this disease should be treated appropriately to lower the complication and to improve symptoms. Number 6, inactivity. High physical activity levels during daily life is associated with less functional decline in patients with peripheral artery disease. In summary, in order then to prevent poor circulation to your lower extremities, there are several modifiable risk factors that you should consider. Change lifestyle, become more physically active, decrease your weight, improve your blood pressure, and improve your cholesterol level. This is Dr. Cooper Dockery. Don't go away. We'll be right back with more on peripheral vascular disease.
Are you tired of being sick and tired and ready to take back control of your health? If so, Dr. Donna Cooper and her team are ready to help. To order her books or the DVD series, Get Healthy for Life and 14 Days to Amazing Health, call 1-844-343-8935 or go to drdonnacooper.com today. Dr. Donna Cooper invites you to connect with us. Like us and share our social media networks. You can watch repeat programs of our shows anytime on Vimeo. Find us on our website at drdonnacooper.com. Your doctor delivered some bad news, but the good news is Dr. Cooper's book, Get Healthy for Life, can save your life. Order today at drdonnacooper.com or call 1-844-343-8935.
Welcome back to Get Healthy. This program is designed to educate you and show you how to live a healthier lifestyle and prevent chronic diseases. And today in our show we have Dr. Carlos Morales. Welcome, doctor.
Thank you, Dr. Cooper. Thank you for having me.
Can you tell us a little bit about yourself?
My name is Carlos Morales. I'm a cardiologist. I'm board certified in internal medicine, cardiovascular diseases, interventional cardiology, and I am the chief of cardiology at Renaissance. I'm also a director of the cath lab and assistant clinical professor with the University of Texas.
Well, thank you.
Thank you for having me.
Now, we are going to be talking about peripheral vascular disease. Can you tell our audience what that word means?
Peripheral vascular disease is when people have blockages in the arteries of the legs. They're usually associated with smoking, high blood pressure, and diabetes are the most common risk factors.
What are some of the symptoms for peripheral vascular disease?
The symptoms of peripheral vascular disease are twofold. Number one, patients may have what we call claudication, which is pain in the legs when they walk, and the pain stops when they stop walking. The second symptom that we see in people with peripheral artery disease is when they have ulcers in the legs, particularly in the toes, which is a manifestation of more severe and advanced disease, particularly in people with diabetes.
How can we prevent this type of problem?
The way how we prevent patients with peripheral arterial disease is to make sure that their cholesterol is controlled, that they don't smoke, that their blood pressure is well controlled, and they will be on a cholesterol medication if they must.
Very good. So we go right back again to lifestyle. Am I
Lifestyle
right?
modification, yes.
Good. So they have to eat right, avoid the saturated and the trans fats, right?
That's correct.
And these fats are only seen in animal products, am I right?
Right.
Good. So these patients should stop smoking, as you say.
Yes,
And they probably should examine their feet frequently.
that is correct.
Because diabetics, for example, do they have sensation? Do they sometimes have no pain, but yet they have poor circulation?
Right. The problem also with patients with diabetes is they may have pain due to neuropathy.
Yes.
And that type of pain must be distinguished from the pain associated with obstruction in the arteries.
Very good. There's so many patients that you see around with no legs or part legs.
Right.
So these patients need to be very careful with their lifestyle to have a happier and more fulfilling life. Am I right?
Yeah, that is correct. Unfortunately, some patients, by the time when they come, they usually present with severe advanced disease to the point that the arteries cannot be revascularized again, and they end up losing their legs.
Imagine that.
Yeah.
Sad story, doctor, but I want to thank you for coming.
Thank you very much, Dr. Cooper. Thank you
And
for
I
having
hope,
me.
yes, and I hope our audience learns something how to preserve their health. Doctor, I hope to see you again.
Thank you, Dr.
so
Cooper.
much.
Thank you for having me.
You're welcome. Don't go away. We'll be right back with more on vascular disease. Hi, meet Sarah, a normal girl like you. But Sarah had a big problem. Sarah was overweight and thus increased her risk of dying young. But luckily for Sarah, she discovered Dr. Cooper's complete weight loss solution, and now the problem is gone. In this solution, there's a set of DVDs, 40 cooking videos, exercise DVDs with exercise band, Dr. Cooper's book 14 Days to Amazing Health with over 100 delicious recipes and helpful tips. What are you listening to me for? Listen to what they have to say.
I was able to lose 20 pounds, I didn't want to, which helped me to drop my high blood pressure medication. My mother lost 50 pounds and no longer takes diabetic medicine through the program.
And I've learned a lot. I've learned that I can prevent any disease by having a healthy lifestyle. I lost 8 pounds, yes.
I came to Dr. Cooper. I had diabetes. Within maybe 2 months, I was doing better. I'm off my medication. I continue to do exercise and follow a diet. Follow Dr. Cooper's directions, and everything will be okay.
For a suggestive donation of $49, we'll send this complete kit to you. go to my website, drdonnacooper.com, or 1-844-343-8935. In our headlines today, researchers have discovered that maintaining a normal blood pressure will reduce the risk of peripheral artery disease. In the Heart Outcome Prevention Evaluation, or HOPE study, 1,715 persons had symptomatic peripheral artery disease and 2,118 persons had asymptomatic peripheral artery disease with abnormal ABI. The HOPE study compared with placebo, ramipril, which is a blood pressure lowering agent, significantly reduced cardiovascular event by 25% in persons with symptomatic peripheral artery disease. In this study, ramipril reduced the absolute incidence of cardiovascular event by 5.8% in persons with asymptomatic peripheral artery disease and by 2.5% in patients with normal ABI. Another study done in diabetic patients with peripheral artery disease, known as the Appropriate Blood Pressure Control and Diabetes Trial, indicated that the incidence of cardiovascular event was reduced in patients treated with antihypertensive drugs, enalapril and nisodipine. Even though it is not yet very clear to these researchers the exact role of these drugs and the prevention and the regression of PAD, it is very obvious that maintaining a normal blood pressure will reduce your risk for dying young. This is Dr. Cooper Dockery, and this has been the health news for the day. Don't go away, we'll be right back with more on peripheral vascular disease after this short break.
Your doctor delivered some bad news, but the good news is Dr. Cooper's book, Get Healthy for Life, can save your life. Order today at drdonnacooper.com or call 1-844-343-8935. Dr. Donna Cooper invites you to connect with us. Like us and share our social media networks. You can watch repeat programs of our shows anytime on Vimeo. Find us on our website at drdonnacooper.com.
Cooper Wellness Center now offers a wide variety of vitamins and nutritional supplements. Omega-3 protection for the brain. Coenzyme Q for your health. Turmeric, the wonder supplement, great for joint pain. Vitamin D3 to promote healthy bones, plus many more multivitamins for women and men. Find these quality non-GMO supplements at great prices online or at Cooper Wellness Center. Live healthy, live smart.
Well, you're in the kitchen with the doctor again today. You're probably wondering, why is she in the kitchen? Well, knowing that the most important thing to change lifestyle is what you eat. So I am going to be telling you how to prepare a healthy, meatless meatloaf. We want to stay away from the cholesterol, so we're going to be using lentil loaf. Lentil, this is a legume that is filled with protein. 1 cup of cooked lentil will provide 14 grams of protein, and for an average adult, you need 60 grams of protein per day. So let's start with our recipe, and you should see the recipe there on the screen. We're going to be using 2 cups of cooked lentils. I already cook it here. It's very easy to cook. It will cook in about an hour, 45 minutes to an hour. 2 cups of cooked lentils, and then to that I'm going to add some onion, chopped onion. You could use 1 medium size of onion, chopped. I will also use some carrots. Here it is, grated carrots. So we're going to combine that right here. Then my chia seed. Chia is filled with good fat, omega-3 fatty acid. as well as fiber. So we have the chia to hold it together. Then we have pecan nuts. You can use whatever nuts you like. Pecan, and you will see the amount there on your screen. And then I'm going to use some flour. Now this is brown rice or oatmeal flour. You could use either one. So we are going to combine that there, half a cup. And then I'm going to use some garlic. So 2 cloves of garlic mashed. So we have our garlic there. And then our mushrooms. So we're going to incorporate the mushroom. And of course, we're going to put some other spices. So I have dried thyme. And I'm going to add some here. 1 teaspoon. It's right here added. Then I like to use a lot of garlic. So I'm going to use some garlic powder, some more garlic powder. Here in this, I'm going to use like half a teaspoon of garlic powder. Just follow the recipe on the screen. And we can also add some onion powder just for spice. Now, if you like all the spices, feel free to add whatever spice you like. So I'm going to use here half a teaspoon right here. And then some salt to taste. It says 2 teaspoons of salt. Remember to use the sea salt. All right, so I'm going to add some salt in here. You can measure it if you're not sure. So we're adding our sea salt. And now let's see if I'm missing anything else. So I have my pecan, I have everything. And then we're going to mix this up properly. Now, if you like cilantro, you can add your cilantro. If you like chili, add some chili. Whatever you like. I like to use fresh thyme that give it a nice Caribbean taste. So I'm going to mix this all up. And if you think you need a little bit more water, or you can add some water, but right now I think this is good. The water from the lentils is good enough. So we're going to mix this up into more like a dough. It is filled with a lot of protein, good fats, all right? And then you're going to place this into a baking sheet or in a loaf pan. And you're going to bake this for about 45 minutes. Now, I have one already prepared for you, looking great. I'm going to slice this. You can have this with your mashed potatoes or anything you like. Now, I'm going to cut a slice of this, and then I have a plate here prepared already. Let's add this there. Okay, hold on, let's see. We're going to cut a slice, add it there. You can make your favorite gravy, whatever gravy you like, and incorporate that into your meal. Okay, we got it. So here it is. I'm going to put a better slice there. So let's get a nice looking slice. Okay, here we go. All right. Now I have some white gravy. I'm going to add that here. And we have a great meal for you. I have a great whole grain. This is called bulgur. I have my vegetable, different colors, whatever you like, and beautiful slice of meatless meatloaf. For more recipe, visit my website, gethealthwithdrcooper.tv or cooperwellnesscenter.com. And in a couple of months, you'll have my book with a lot of these recipes. Until then, I'll see you again soon.
Hi, meet Sarah, a normal girl like you. But Sarah had a big problem. Sarah was overweight and thus increased her risk of dying young. But luckily for Sarah, she discovered Dr. Cooper's complete weight loss solution, and now the problem is gone. In this solution, there's a set of DVDs, 40 cooking videos, exercise DVDs with exercise band, Dr. Cooper's book 14 Days to Amazing Health with over 100 delicious recipes and helpful tips. What are you listening to me for? Listen to what they have to say.
I was able to lose 20 pounds, I didn't want to, which helped me to drop my high blood pressure medication. My mother lost 50 pounds and no longer takes diabetic medicine through the program.
And I've learned a lot. I've learned that I can prevent any disease by having a healthy lifestyle. I lost 8 pounds, yes.
I came to Dr. Cooper. I had diabetes. Within maybe 2 months, I was doing better. I'm off my medication. I continue to do exercise and follow a diet. Follow Dr. Cooper's directions, and everything will be okay.
For a suggestive donation of $49, we'll send this complete kit to you. Go to my website, drdonnacooper.com, or 1-844-343-8935.
Your doctor delivered some bad news, but the good news is Dr. Cooper's book, Get Healthy for Life, can save your life. Order today at drdonnacooper.com or call 1-844-343-8935.
Welcome back. Thank you for tuning into our program today. And as you now realize, many chronic diseases are preventable and reversible. You really don't have to live in pain and discomfort for the rest of your life. You have a choice. Changing habits can be daunting. However, there is hope. God wants us to enjoy good health. And if you desire to change and become healthier, but feel incapable, then reach out to your Heavenly Father and He will give you the will to be healthier. He will give you the strength to succeed. Our Bible text today is found in Philippians 4 verse 13, and it says, I can do all things through Christ who strengthens me. So therefore you have no fear. If you put your trust in God, He will give you the strength to do all things. I encourage you to pick up your Bible this week and read a few verses. There you will find inspiration in them, and then you will be able to have strength and healing. For more information, call us at 956-627-3106 or visit our website www.gethealthywithdrcooper.tv or www.cooperwellnesscenter.com. This is Dr. Cooper saying so long until next week, same time, same station, and I hope your lives have indeed been blessed.
This broadcast was sponsored by Cooper Wellness Center and Faithful Path International Ministries. For more information on how to become a patient or a sponsor, please contact us at 1-844-343-8935 or visit our website at drdonnacooper.com.